Karbala in Gaza. Dr. Tahir, thank you for taking the time from your busy schedule to speak to us. You've been on the ground now for months now, I'm sure you can correct me, mostly working in the north. Can you just give our viewers around the world a sense of what you have been seeing with your own eyes?
Good evening. Thank you for having me. That's correct. I've been here for several months now. This is my third mission, and I've been here for close to 3 months, if not longer. I've worked both in the southern half of Gaza in Al-Aqsa Hospital and also in the north, where I was there for around 5.5 weeks. And then the situation in the north is grave. What I've seen is a complete annihilation of the people, really. I worked in the public aid hospital. We served as a specialist unit for emergency general surgical cases, neurosurgical cases, and polytrauma cases. And I saw people from across all the spectrum of society being hurt and killed, including women and children. I treated babies less than 1 year of age, one of whom sticks in my mind, who came into the hospital with an abdominal injury and a near total amputated leg, which I tried to save, but unfortunately wasn't able to. The memories of the north are very strong in my mind because I was constantly listening to the bombardment that was occurring around us. I would go to the rooftops of the public aid hospital and I would hear massive explosion after massive explosion. And it seemed to be that I was truly on the front line. And this was a place which was being completely wiped out. And we saw this, it was reflected in the injuries. We had innocents killed, we had colleagues killed, we had colleagues hurt. It's been the situation here for months and nothing has changed.
And I remember seeing the little, I think she was 1 year old, the little girl whose leg you had to amputate. I think she had no family left. I saw it on your social media. And I know how much that shook you, and it should have shaken anyone to the core. And that was the youngest person you've had to amputate, is that right?
That's correct. We had just treated her 20-year-old or so mother, and she was critically unwell. Her father and her other brother were killed on the scene. She came in, she had abdominal injury, and she had a near total amputated left leg, which I tried to save, but I couldn't. And her mother died that same evening due to her injuries. Her injuries were very extensive, and they were from literally from her chest all the way to her toe. And despite our best efforts, we tried to save her mother. Her mother died, and she was left as an orphan, limbless. And in fact, yes, the youngest person whose limb I've ever had to amputate.
And Dr. Mohammed, today we heard from the ICRC, the Red Cross, that's saying that the health system in the north has been obliterated. We've also heard from the WHO, who said the hospitals have become a battleground with staff being detained. I mean, we've mentioned Dr. Hussan Abu Sifa, the director of Kamal Adwan Hospital, of course, the last remaining hospital that's now out of service. Do you, I mean, on a personal level, and I know you won't want to focus on this, I mean, what are you hearing about the doctor? And do you worry about the rest of your colleagues at this point?
So when I was in the north, Dr. Hussan was injured. I tried to make the attempt to go to Kamal Adwan Hospital to treat him. This was flatly rejected. In fact, we had Indonesian colleagues who were trying to go to Kamal Adwan on several occasions, and were rejected repeatedly until one time, so very surprisingly, were accepted. And then 1 or 2 days later was sent back walking from Kamal Adwan to the public aid hospital. and having had all their medical kit confiscated. So they were literally humiliated and sent back. When I was on my way to to the north of Gaza, I was speaking to a UN security personnel. This was 5 or 6 weeks, maybe 7 weeks ago now. He told me that a IDF officer had told him that Kamal Adwan was no longer a hospital and that they had to make the plan to forget about it. So this was a clear plan for several weeks beforehand, that they wanted to wipe out Kamal Adwan Hospital and inflict a very significant injury to the healthcare system there. I would say mortal injury, because now you have no functioning hospital to serve the entire population of the north of Gaza. Bear in mind, these people have no way of connecting with the rest of the world. We don't know who gets hurt and when. Nobody can come to save them. They are in and amongst a wipeout. We used to hear the thunderous sounds of these bombs. They would shake our rooms, our operating rooms, our beds, and it was constant. I am afraid for them. Of course, I'm afraid for my colleagues. We've had colleagues killed. So I'm very afraid for Dr. Hassam and for his well-being. And I fear for what might happen to him in jail.
And the Israeli military claimed the facility was being used as a Hamas, and their words, command and control center, but important to point out, did not provide any evidence to support that claim. Dr. Mohammed Tahir, as always, really value your time speaking to us here, giving us the clarity of what you're seeing on the ground and, of course, all your work that you're doing on the ground as well. Thank you, Doctor.
Thank you very much.